Preview.
Today I'm going to teach you the Woodpecker Walrus technique for nasal packing.
Background.
Winter is nosebleed season. Often we treat these immediately with prefabricated nasal packings, and they're effective, but they really hurt, and some patients just can't tolerate them, or the packing will migrate out of their nose, or the patient will vagal and pass out. You don't always have to start with this most painful, most aggressive method.
Procedure.
First, tape the ends of 2 tongue depressors together to make some tongs, and then trim down the ends of 2 of those little green swabby sponge sticks that we have. Next, take an absorbable hemostatic agent like gel foam or Surgicel, put it in a kidney basin, and squirt it a couple of times with some oxymetolazone or phenylephrine nasal spray, a little bit of lidocaine with epinephrine, and if you have it, a little bit of topical tranexamic acid, and then mix it all together with the little green spongy things. Have the patient blow their nose hard, and then put the hemostatic packing in the affected nostril, follow it up with the sponge sticks on each side for a little bit more pressure, and then put on the nasal tongs. If the tongs tend to slip off, you can have the patient pinch them a little bit for extra pressure, and even apply an ice pack if you want. Wait 15 to 20 minutes at least. This way you're putting pressure on the anterior plexus from 2 different directions, and your sponge sticks act as a reservoir for more of your hemostatic cocktail. Next, gently remove everything except for the absorbable hemostatic packing that's still in their nostril. Apply some benzoin along the side of the nose and the very bottom of the septum, and put a steri-strip on which will hold the packing in place. Watch the patient for a bit to make sure they don't have rebleeding, and then send them home with the usual antibiotics and instructions. Give them the tongs as a gift. This is a much more comfortable form of nasal packing. Remember that the super painful packing products are still an option if this doesn't work. Try to be kind.